What if I tell you that there are three things that you need to work on to get better at your clinical skills? Hi everyone, in this video, I'll be telling you all how to master three skills that matter the most and how to get better at each of them. So starting with the first part, the three most important skills, the ones that form the foundation of your clinical skill are assessment, diagnosis and treatment. Assessment is the skill where you assess the patient's problems, you try to find out what the complaints are, you try to objectively measure what the extent of those problems is. Diagnosis is after assessment, you come to the problem that okay, if these are the findings, then this is the diagnosis. If these are the symptoms, then this is the condition. And treatment is where you finally implement the solution. You treat the patient's cause. Now imagine whenever a patient comes to you, that patient comes with certain set of complaints, and that is the data that the patient gives. The more data you collect, the better it is going to be. So understand these three skills with the help of this example. Assessment is all about collecting data. The more amount of data I have, the better I will be able to analyze it. So my goal should be to collect as much amount of data as possible. So if a patient has come to me, I need to take the history in depth. I need to find out what are the aggravating factors, what are the relieving factors, everything. What was the mechanism of injury, how did the pain start, in detail history. So all of this is collecting data. I am trying to find out how did the pain start, when does it increase, is there any diurnal variation, and so on. So that is about the history. Then I start with observation. I try to observe what are the patient's impairments, how much is the patient's problem, and how do I objectively check that. So in the assessment, your goal should be to try and do as much as you can so that you find out all the problems, all the complaints. So I will check the posture, I will check the gait, I will check the patient's ranges, tightness, strength, and so on. As much assessment as I can, I have to do that. So that is about collecting the data. So I have collected as much data as possible. Next is diagnosis. Diagnosis is where you correlate all that data and come to the problem. You try to analyze all the data. So okay, these are the complaints. What is the reason for it? So that is about the diagnosis. I have found out these 5 things and all of this correlate to come to this problem. So this is the diagnosis. And last is treatment, which is about implementing the solution of that problem. So it is as simple as this. So whenever a patient comes to you, the main goal should be to first collect as much data as possible. So try to assess the patient as in as much depth as you can. Next is good diagnostic skills that you need, and last is treatment. Now if I have to explain this with the help of a pyramid, assessment comes at the base, second is diagnosis, and last is treatment. Why does assessment come at the base? Because assessment is that skill which is the most difficult to master. The difficulty level increases from below to above. So as you go up, the difficulty level decreases. Assessment is the most difficult skill to master, then comes diagnosis, then comes treatment. Why is assessment difficult? Because you are trying to find out what is the reason by just knowing the patient's complaints. You are trying to find out the cause. If a patient has complaints of pain and restriction in overhead activities, now you will do certain tests and try to interpret what all is the reason, what are the findings, are they positive, are they negative. Then comes diagnosis, and then comes treatment, which is comparatively easier than the first two. So assessment is the base of your entire the base of your entire clinical skill. Only when you do good assessment will you be able to treat the patient properly. So your treatment is going to be as good as your assessment. If you do an in detail assessment and come up with the proper diagnosis, your treatment is going to be that great. But if your assessment is just generalized and you don't do much assessment, then your treatment is also going to be that way. You are not going to treat the patient properly if you don't come up with a proper diagnosis. Now coming to the next part, which is how to get better at each of these skills. So first is assessment. In assessment, you need to do three things. First, you need to know the technique of whatever it is that you are assessing. Second, you need to have a good interpretation. You need to interpret it well. And last is you need to think well. You need to think critically. So let's understand all these three. So let's understand the first one, which is the technique. So if I am checking the limb length, that is something that I'm checking. Now I need to know how to check the limb length, how to check the apparent limb length, how to check the true limb length. If I'm doing a special test, then I need to know how that special test is performed. If I'm checking the range of motion, I need to know, for knee, this is the placement. This is how the position of this is how the patient should be positioned. This is how the therapist should place their hand. So that all comes under technique. Next is interpretation. So I need to interpret the finding properly. Now, after I've checked the range of motion, I should be able to understand, is the range of motion decreased, is the range of motion increased? And if the range of motion is decreased, then that indicates hypomobility. If the range of motion is increased, that indicates hypermobility. If I am checking a patient's shoulder range of motion, so the complaint is that the patient has difficulty in doing overhead activities. So on assessment, I find out that the flexion range is restricted. Now, what is the end field? So if the range is restricted, is it because of pain? Is it because of stiffness? If it is because of pain, then the end field is empty. If I am able to feel soft tissue restriction, then it can be because of the capsule. So the end field is soft capsular. So all this will come under interpretation. And for all of this, you need to have the ability to think critically. You need to reason out, why am I seeing this? What can be the reason? These are the three things that you need to do to get better at your assessment skills. And the most important, you need to practice. Practice as much as you can. If you are doing a special test, do it 4 to 5 times on first a normal individual. Then only you will understand it when you do it on a patient. What will be the positive finding when a patient comes to you? Same applies for every other technique. If I'm checking the range of motion, first you need to know how the normal range of motion is checked. Only then you will understand that this is not normal. This is where the range is restricted. Next is diagnosis. So diagnosis, as I said earlier, is about analyzing all the data, correlating it and coming up with the final problem. So for that, you need to know about different conditions. You need to know that these are the symptoms when the patient has PIVD. These are the symptoms when the patient has adhesive capsulitis, the diagnostic features. If a patient has osteoarthritis, these are the symptoms that the patient will have. If the patient has rheumatoid arthritis, this is the most important finding that I'll get. Only when you know that, you will be able to understand the patient's complaints. That okay, if the patient has stiffness and the stiffness lasts for less than 30 minutes and it is usually after waking up, then it can be spondylosis. So this is how you have to logically reason out things. If the patient has pain on flexion, but the patient feels that the pain decreases on extension, then what does that indicate? In which condition is this feature commonly seen? So for that you need to have a good knowledge about different conditions. Your eyes can only see what the mind knows. If you don't know about the different conditions, your knowledge is limited only up to 3 to 4 conditions, and that is what you will see in every patient. If I don't know about the 10 different conditions of knee, I know only about 5 of them. That is what I will observe in the patient. That my knowledge, my understanding will be limited to only those 5 conditions, and then I will not be able to come up with the appropriate diagnosis. So if you want to get better at your diagnosis, you need to read a lot, you need to read about different conditions, and most importantly the diagnostic features. If there is a meniscal injury, what is it that is going to be seen? Locking of the knee is usually seen. If there is a ligament injury, instability is seen. If ACL is injured, then what is the complaint? If PCL is injured, what is the complaint? You need to understand the diagnostic finding, diagnostic feature. By diagnostic feature, I mean that particular symptom will be seen in that condition. If I say that locking is seen in meniscal injury, that becomes its diagnostic feature. If there is a mechanic and he has to repair the car, for that first of all he needs to understand what the problem is. After he has understood what the problem is, now he needs to come up with where the problem is. For example, if the car suddenly stops in the middle of the road while driving, then you have to find out what the problem is. The mechanic has to find out whether the engine is damaged or some other part is damaged. For that, the mechanic needs to know that whenever the engine is damaged, this is all that will be seen. This will be the problem list. Similarly, you need to know that in osteoarthritis of the knee, these are the symptoms that you'll see. Only then you will be able to understand when a patient comes with those symptoms. So you have to go in the opposite direction. You have to go in the reverse direction. You need to go from the symptoms to the diagnosis. Next is treatment. So for treatment is comparatively easier. Assessment and diagnosis are far more difficult. Treatment is about implementing the solution. So when I have diagnosed what the problem is, now I need to have for treatment also you need to have options. By options I mean, if the range of motion is restricted, these are the 3 options that I have. These are the 3 things that I can give. If the range of motion is restricted, then I can give joint mobilization, I can give muscle energy technique, and so on. Now I have to pick the best one. And how will I pick the best one? Based on which works the most effectively in that condition. For that I need to know the rationale of each treatment. So when does joint mobilization work the best? When does muscle energy technique works the best? So for range of motion restricted, if the patient's range is restricted, I have 2-3 options. I have to select one out of them. That is how you go ahead with the treatment. So this is how you can get better. These are the few things that you need to work on so that you improve and your clinical skill overall improves.